Welcome, everyone, to our second academic hot topic session of 2022. My name is Leah Everett Burks. I'm the Industry Outreach Lead at the MSU A-CAPP Center. We design these sessions to be in-depth conversations with our academic partners and fellows who are doing research relevant to brand protection and counterfeiting. These events are free and open to anyone in the field of brand protection. We are recording this session and we'll have it available on our YouTube channel following the event. This series is part of our outreach program, which focuses on topics relevant to brand protection professionals. We encourage you to visit our events page for upcoming events, including our World IP Day event, which will be live streamed on April 26th. And in keeping with the theme this year, it will be a conversation between A-CAPP's Brandon Drain and young entrepreneur and innovator Sean Williams of the Detroit vs. Everybody brand. We also have a robust student internship program at A-CAPP, training the next generation of BP practitioners. If any of you are interested in hiring one of our students or our recent grads, please reach out to me or anyone at the center. A special thanks to everyone at A-CAPP who helped make this possible. Brandon, Carrie, Jeff, and Sarah. And I would like to thank our gold sponsor for this series today, Abbott. I'm excited today to be hosting on an authority on counterfeit pharmaceuticals, Dr. John Hertig, who has contributed to this discipline through various research and studies, including articles written for our very own The Brand Protection Professional. For the June 2020 BPP, he co-authored What Health Professionals Need to Know, highlights from the OECD EU IPO report on trade in counterfeit pharmaceutical products. And in December 2020, Purchasing Medicines Online, what the data reveals on the need for a shift in communication due to the COVID-19 pandemic. Links to these articles, plus others, will be sent to you in your event follow-up email after the session. And as you heard last month, John also collaborates with MSU faculty, including Salim Al-Habash, who was the first guest in this series on counterfeiting and social media. Again, if you missed that session, you can view it on our YouTube channel. So just a little bit more about our distinguished guest today before we launch in. Dr. John Hertig is Vice Chair and Associate Professor of Pharmacy Practice in the Butler University College of Pharmacy and Health Services. He lectures around the world and publishes on a variety of patient safety, leadership, administration, and health policy topics. His extensive research program is designed to enhance the safety of the medication use process while using evidence to inform patient advocacy efforts. Please feel free to read our complete bios on the A-CAPP Center website. And just as a reminder, before we start our discussion, as you'll see on the screen, all attendees can submit questions via a Q&A feature in this webinar. We encourage your questions and your participation. So welcome, John.
Thank you, Leah. Really my pleasure to be here, and I appreciate the invitation from you and the rest of the great team at the A-CAPP Center at MSU.
Great. Well, I thought we'd start at what I think is kind of the beginning of your topic. How were consumers first introduced to online counterfeit pharmacies?
Yeah, thanks for that great introductory question, Leah. And as long as the internet has existed, as long as there has been e-commerce, there have been individuals who have sold medicines and medical products online, and that has obviously exploded since the introduction in the late 90s and early 2000s and beyond. And what we see is there are probably three key drivers influencing the way that people buy products, medical products, medicines online. And those three key drivers are cost, convenience, and access. And most of us go to cost first. We think that people are going online because it's a better deal, so they can shop around and they have access to a wide variety of options and they can compare costs. And particularly in the United States, where there's this both perception and reality of high prices, particularly with prescription medicines, that we can go online and we can find a better deal, perhaps from the United States or perhaps from somewhere else, say Canada. And we'll get into Canada in a little bit in our conversation. But that cost is a key driver. The others, though, convenience and access, have increased, especially because of the pandemic. And I know we'll be talking a lot more about the COVID-19 pandemic and its influence on prescription purchases online. But convenience and access have really increased as a main driver for people going online. Convenience, for sure. I think we're all used to it, right? We can go on Amazon, we can go on another e-commerce platform. Maybe you're a Prime member, you can get it within 2 days or same day. And that convenience factor of being able to be at home in your pajamas or wherever, ordering things online and having it drop shipped to your door is a major driver in general, but also in healthcare consumption. And then access. And that access question is complex because, we in the United States don't all live in urban or suburban areas. Many of us live in rural areas that have pharmacy or healthcare deserts. And so access to quality care can be a real issue for many Americans in this country. The internet has served a great role in either providing medical information as well as access to product that individuals who just don't have that access may otherwise not be able to get. There also is this access question of, do you feel comfortable accessing our healthcare system? So we did a big study in the city of New York around counterfeit, substandard, falsified PrEP for HIV and AIDS treatment. And it wasn't so much that it was a cost factor, because much of that is covered by public health plans or other health plans. It was more of the desire to be anonymous. So you have a group that is marginalized or underrepresented that doesn't want to go into a sexual health clinic, that doesn't want to actually access our healthcare system in a traditional way. And so they're going online to access care because they don't want to be seen, particularly. They don't want the stigma. It's a really unfortunate and complex circumstance, but it's not cost as a driver there at all. It's that access issue. So we see that increased in a variety of different patient populations, cost, convenience, and access, that are really driving the increased utility of our online pharmacies.
Yeah, it's interesting too that the phenomenon kind of grew with Canadian pharmacies, right? And I always found that interesting because I think it was, we trust our neighbors to the north, so it's got to be legitimate. And later we found out that these were actually illegal pharmacies. But also interesting what you were talking about, depending on the medication that the patient is shopping for, how comfortable they are going to traditional sources or pharmacies, and would rather, because of embarrassment or other reasons, shop online. And definitely we'll get into how this has changed with COVID-19, because everything has changed with the pandemic. But I think also, even coming out of it, hopefully, we don't shop in person as much anymore. So where it was a convenience, now it's just our way of shopping is online for everything, for groceries and everything else. So I imagine that this will continue to be a problem, and probably a problem that will grow.
You're absolutely right, Leah. I mean, we've seen, if we just touch on the pandemic for a moment, and I know we may want to get into some detail, but if you look at the COVID-19 pandemic as a driver of using online everything, including online healthcare and pharmacies, we saw approximately because my research team and a number of other individuals who do work in this space have been tracking the increase of use of illegal online pharmacies or online pharmacies for a number of years now, dating back to 2015, 2017. Then we did a 2020 study. And what we found is, as a result of in that 2020 study, is that we had a 47% increase in the use of online pharmacies from 2017 to 2020. And what we found as part of that data analysis, as we dug in a little deeper, is that of that 47% increase, about 36% or so, 31% to 36% was due to the pandemic, but the other was just part of the natural increase in e-commerce. So pandemic or not, we were seeing growth in an explosion of the use of e-commerce to access medicine and healthcare. What the pandemic did is just accelerate that, threefold. And so we have this 47% increase, 31% due to the pandemic, the remainder due to just the natural course of e-commerce growth.
Yeah, so the timing of the pandemic just kind of dovetailed into that growth,
It did.
right? It was a natural growth.
It
Yeah.
was. We thought, well, I don't know. I don't want to speak for everyone in this space, but I'll speak for myself. We thought we had a couple more years to try to get a better handle on this issue and start to really drive education and implement some of these interventions. We lost all that time because of the pandemic, right? So that explosion in growth really accelerated what we knew was going to happen anyway. And I've dubbed this, as some others have too, the perfect storm of patient safety online, is because we have this confluence of people wanting access, struggling financially to afford medicines, are comfortable with online platforms, and now you have people who are stuck at home either because of healthcare reasons or stay-at-home orders, and all they have is their laptop or PC in front of them to order product.
Yeah, I think Perfect Storm captures it very well, definitely, especially in this space. So talking about just generally medications, they're an integral part of our wellness, treatment of diseases, conditions, and overall healthcare regime. What are some of the stats on just generally how prevalent medications are in our lives?
Right. So if you look at the adult population, because it's not just adults that take medicine, but there's a lot more data around adult use of medicine, and is anywhere between 50 and 60% of American adults are on at least one prescription medicine. Many are on multiple prescription medicines, and a large cohort over 3 prescription medicines at any one period of time. So clearly, Americans are consumers of prescription medicines. And they need to get access to those. Many of us still use the traditional supply chain, brick and mortar pharmacies, but you have a significant portion of the population that are turning to the internet to buy their prescription drugs.
And you kind of touched on this, but can you lay out some of the specific medications that you see as most counterfeited?
Yeah. Well, I think traditionally, and we've learned a lot from lower and middle income countries in this respect, where we have significant issues with antibiotics, pain medicines. Those are traditionally counterfeit in some of our lower and middle income countries. But as you look at the internet as a way to access these products in higher income countries, we see products like lifestyle drugs, and then things like hormone replacement therapy, drugs that are on shortage. Ultimately, anything that's prescription can be found online. And if it's on shortage or restricted in some way, like some of our narcotics or opioids or antibiotics or hormone replacement or things that are expensive like cancer therapies, which is really sad, they're all available online. You can get any of those medicines online from usually nefarious locations. And that has expanded. We did, in some of the same work that I mentioned, if we take a 2017 survey that we did of the American public and we compare that to 2020, we looked at 4 different categories or classes of medicines. We looked at medications for acute conditions. So those would be things that are in short duration, like an infection or maybe short-term pain use. In 2017, acute conditions, medicines for acute conditions, about 23% of the people who bought medicines online would buy those. In 2020, that was up to 72%. So we went from 23% to 72% in 3 years. We then looked at OTCs. Those are over-the-counter products, your Tylenols, your ibuprofens, your vitamins, things that you can get without a prescription. In 2017, that was 34%, up to 80% in 2020. So we're seeing exploding growth in purchasing of these products online. Specialty medications, and specialty medications are typically synonymous with expensive. So these are our anti-cancer agents, hormone replacement therapy, monoclonal antibodies. 21% would consider buying those in 2017 online, up to 67% in 2020. And then finally, medicines for chronic conditions. That's like blood pressure medicines, high cholesterol medicines, things that you take for a long duration or chronic duration of time. 42% would buy those online in 2017, up to 78% in 2020. So across the board in every single category, Leah, we're seeing an explosion of growth in medicine use online.
Yeah, sounds like it, just an explosion. And some of those medications you're talking about, John, I think if people hear about counterfeit antibiotics, they may dismiss it as, oh, well, it's just for an infection. But when we look around the world and we look at, uh, developing countries and so forth, even in the United States, if a child is not properly treated with antibiotics, they can die. So
It,
even the ones that maybe are not a cancer medication or critical medication maybe category, those can have detrimental and deadly effects. Also, because they may not just have inert ingredients, they may have replaced ingredients that are deadly. Is that correct?
that's absolutely correct. And I think, anything that you put in your body is critical, right? And it's hard to judge a medicine by what it's used to treat. And you mentioned the antibiotics as an example, and you're absolutely right. There are horrific case studies around the world of anti-malarials being counterfeit, and rather than put the actual anti-malarial agent in there, what they'll do is they'll replace it with Tylenol. And so it's tragic because if you think about it, you're taking this, it doesn't actually include the active ingredient or not enough of it because it's been cut with something else, but it contains Tylenol. And so to the actual patient, you're taking this and your fever is going down because of the Tylenol, but it's actually not treating the infection. And so you think it works in the short term, but you end up dying. And there are terrible case studies, a lot in children, which is
Yeah.
just the worst possible thing to think about, where these have had impact. But it's not just limited to lower and middle income countries. It's also coming to the United States. We've seen cases in the U.S. We've seen cases in Canada, in the UK of this issue. In the UK, there was a lot of cases of diet medicines and diet pills that were cut with really deadly substances. Here in the United States, we have an opioid epidemic. We also have a real issue with fentanyl. And so, yeah, you think you're getting a Xanax for anxiety, but you don't know that Xanax has been cut with fentanyl. And so, you have a college age kid, a high school kid looking to take a Xanax or maybe a Percocet for back pain before an exam or a run. They lay down for a minute and they never wake up because it was full of fentanyl. And now you have grieving parents in a tragic situation. So it's never as simple as, oh, it's not a cancer agent or it's not this really expensive agent, so don't worry about it too much. Anything you put in your body can cause catastrophic damage because of these other materials and products and items that are cut in these substandard and falsified medicines.
Right. And in the counterfeit world, we know on almost across the board on all products. Of course, the counterfeiters are trying to just look like products. So for pharmaceuticals, I've talked to obviously a number of brands in the pharmaceutical world through my career and heard some horrific stories where, maybe a tablet had a certain yellow tinge to it, the legitimate tablet did. So the counterfeiter trying to match that color used highway paint
Mm-hmm.
for, separating of lanes on the highway. So talking about toxic medications, that's what people were ingesting was toxic paint. So yeah, kind of what you're saying, anything ingested that has not been approved for efficacy and safety, you're putting yourself at risk.
Yeah, I mean, absolutely. In another famous case that we talk about a lot is antifreeze, used as a cheaper sweetener. It's a glycol derivative, and it's a couple cents cheaper than the thing that doesn't kill you. But if you think about what medicines are typically used, or sweeteners are typically used in liquid medicines, again, meant for kids. And so there's lots of horrific case studies of these criminals who are using antifreeze to sweeten medicines for kids, and those kids either get significantly harmed or die.
Wow, just tragic. Doesn't even fit the magnitude of that.
Yeah.
So stepping back a little on the online pharmacies, do you have an idea of how many active online pharmacies there are currently?
We do have a general idea. As you can imagine, with trying to track websites in the thousands, it's an imperfect science. But fortunately, we have some great partners, including colleagues at the National Association of Boards of Pharmacy, that have published some great data on this issue. And by their estimation, anywhere between 35,000 and about 40,000 online pharmacies are actively operating at any given time worldwide.
Wow. Okay. And something that comes to mind when you think of that magnitude, are they all illegal, or are there legitimate pharmacies online?
There are certainly legitimate pharmacies online, and there are pharmacies that are doing the right thing, that are providing a needed service to patients. As I mentioned in the beginning, the internet can be our friend, right? It does provide an access point for good information. Unfortunately, a lot of bad information, as we're seeing, not just in healthcare, but really in every discipline. But it does provide great information. It does provide access to healthcare services, whether via telemedicine, telepharmacy, having access to product being dropped to your door to provide that needed medicine and treatment to those who can't access a traditional brick and mortar site. So the internet can be our friend. Unfortunately, of that 35,000 to 40,000 active online pharmacies, about 95%, give or take, are illegal in some way. That means there's only 5% that are doing the right thing. 95% are illegal in some way. Either they're not licensed in the proper jurisdiction, they haven't been vetted appropriately, they don't sell FDA approved medicines, because the US FDA, that's our medicine regulator here in the United States. So you do have to sell medicines that are approved by the FDA. And by some estimates, including the WHO, about 50% of websites that hide their physical address, and many of them do, especially ones that are hosted outside the United States, about 50% are selling substandard, falsified, or counterfeit medicines. And so if you're an average US consumer, you're using a search engine, you have 95% of your options out there that are illegal, and you have half that are probably going to sell you something that's not going to help at best, but maybe hurt at worst.
Okay. And just a reminder to the listening audience, you can submit questions. Be sure to hit your return button after you end typing. It looks like there's a couple of pending ones that haven't come through yet, so be sure to hit return so we can take a look at those. So leading in a bit to the pandemic, John, we all know that there have been supply chain issues for every brand category. For pharmaceuticals, does the fragmented supply chain contribute to counterfeit issues?
It's a complex question, Leah, and a really good one. I would say overall, if you look at the traditional pharmaceutical supply chain in the United States, we have one of the best supply chains in the world. Very secure in general, thanks in large part to the various vendors, manufacturers, stakeholders who have worked really hard to make sure that our pharmaceutical supply chain is one of the best in the world. And then we have additional regulation, including track and trace and DSCA, that have added some robustness to our supply chain. So if you use the traditional supply chain, even though there are case reports, and we've seen some of some illegal product or counterfeit product or substandard falsified product entering our traditional supply chain, that's pretty rare. But the online supply chain is a little bit of a different story because of the fact that so much of it is hidden behind the veil of the internet. And many of these illegal online pharmacies or illegal internet actors are using something called a bifurcated supply chain. And I don't know if everyone's familiar with this concept, Leah, so allow me to maybe elaborate in just a little bit more detail. But the bifurcated supply chain occurs when it's a single source but two pathways. And we often see this with US consumers trying to or attempting to buy product from Canadian online pharmacies. And I use Canadian with quotes because it's really not Canadian. You know, our Canadian friends to the north also have a really robust, secure supply chains, not unlike the United States. They have Health Canada, which is a wonderful regulator approving their product. But criminals are taking advantage of the US consumer trusting things from Canada. And so you have the situation where, if I'm in the United States and I'm online at a Canadian online website, that Canadian online website knows where I am because I'm have my IP address. And so they say, okay, John's in Indiana. He wants to buy simvastatin, which is a cholesterol medicine. I'm not going to send him the Health Canada approved one. I'm going to go and I'm going to source that from a different source. Perhaps that's from Mauritius or India or somewhere else that's a lot cheaper and could be falsified, substandard, could be diverted, so it could be stolen product. They then source it from there, they relabel it, and they ship it to me. If the same consumer in Ottawa, in Canada, goes to the same website, they know they're from Ottawa, they know they're under the regulation of the board in Ottawa of that province of Ontario, and they don't want to get in trouble, and so they ship that person the Health Canada approved product. And so you have the same source, but two bifurcated supply chain loops. In addition to that, we have just the purely illegal online pharmacies that aren't even in Canada. And so me, John, again, I go to this Canadian online pharmacy. It's not in Canada. It's hosted in Brazil. It's hosted in Russia. It's hosted in China. And I'm not trying to call out specific countries to condemn them, but this is based on evidence. This is what happens, is they're hosted there. They process my bank payment through maybe a bank in Azerbaijan because our traditional bank system will flag them as fraudulent. And so they can't process through Visa or MasterCard. And so it processes in Azerbaijan. It gets sourced again from maybe Mauritius. It gets shipped to someone in a back room in Canada who repackages it in nice packaging that looks Canadian and then ships it into the United States. And me as a US consumer, I have absolutely no idea that they've taken advantage of this fragmented supply chain around the world. That's what makes it so dangerous, is there's absolutely no transparency. We don't know where it came from. And more often than not, you're probably getting something that, again, at best isn't going to help. And at worst, is going to either harm or kill you.
Yeah. Wow. Thank you for walking us through that, because hearing about the chain, again, so many people have been fooled by, well, this is coming from Canada, so it's got to be safe. We do have a few questions for you. This question is from William in our audience. Whose responsibility is it to stop fake medicines?
Yeah, I appreciate that question. And I'm going to give you the easy answer, and it's kind of everybody's responsibility to stop fake medicines because it is a complex supply chain, and because there are so many stakeholders involved, it's going to take a multimodal approach to really make significant impact, Leah. And the way that my colleagues have described this, and I've kind of adopted their way of describing it, is there are two major buckets of focus and intervention when it comes to substandard or falsified medicines. One is tackling the supply side, and the other is tackling the demand side. So the supply side is typically a law enforcement or regulatory approach where you're actually going after the criminals to try to shut down the supply. Unfortunately, much of this is happening ex-US. So our jurisdiction is limited in terms of shutting down and preventing some of the criminality. But also it's really hard to actually find the criminals because, like any good drug dealer, it's, when you're capturing people, you're not capturing the kingpins. You're not capturing the people who are in charge of it all. You're capturing the kind of low-hanging fruit in the front line that has very little impact on the overall operation. And so it's a whack-a-mole situation in terms of trying to shut down the supply of these SF medicines. But there's great work being done there. I don't want to discount the importance of it because it's really worthy work. And I've had the absolute honor to interact with some of these individuals from our law enforcement agencies, from the FDA, who are doing amazing work. My focus is more on the demand side. So how do we educate our patients? How do we educate them to go to safe sources online? How do we work with our health professional community? Because we have a real long way to go in our health professional community around educating them on how often their patients go online. You know, we did a survey and a study around physicians, pharmacists, and nurses and asked, hey, do you talk about online pharmacies and online access with your patients? The vast majority of all three of those professions didn't even talk about it, right? And then of those that talked about it, about half said, yeah, we do talk about it, and we talk about how dangerous it can be. The other half talk about it and say, no, it's a great thing, do it. And I have stories of physicians who actually have handed over slips of paper of saying, here, go to this Canadian website. You know, you're having trouble accessing your medicine, go here. And you know, we have a great example of CanadaDrugs.com. I had physicians recommending CanadaDrugs.com that subsequently got seized by the FBI, shut down, and their owners indicted. So clearly in the health professional community, we have a lot of work to do to not only arm ourselves with the right information, but then help educate our patients so we kind of limit the demand side.
Yeah, and I think that that was part of the subject matter of your December article for the BPP was talking we need to change the conversation that we're having with patients and talk about the dangers of shopping online for pharmaceuticals. So very interesting. We do have another question that's come in. How has the decriminalization of marijuana and potentially psychedelics and derivative products in multiple states had an impact on online counterfeit sales?
Yeah. It's a really good question, and it's a decent thing to think about. We haven't actually done a whole lot of work in that space, primarily because our work is focused on prescription medicines, and those products that were just mentioned aren't prescription medicines, and many are still classified as Schedule One substances by the federal government. And so we haven't done a ton of work in that space, but I do think as we decriminalize, as we potentially do more research or allowed to do more research on the medical utility of those products, that we might see that again creep in and those lines blur between our traditional prescription or OTC products and cannabidiol or cannabis containing products.
Okay, all right. And an area that you have done extensive work on, as more and more brands from all industries are seeing increased threats from social media postings, links selling counterfeit products on social media. As mentioned, you did a story with Dr. Salim Al-Habash on the subject. What do you see from that study as the primary takeaways?
Well, first, I do want to give kudos to Dr. Al-Habash and his team because they're an absolute joy to work with. And, you know, we've really been able to elucidate some really important information around this, I would say, transition or continued transition from more traditional websites or web-based e-commerce sites to the use of social media and related platforms to actually sell prescription products. It's exploding. It's really expanding, and particularly in our younger population, which makes perfect sense. They traditionally are going to be more adept at using some of our social media platforms. But what we did in this study, and I know Salim probably talked a little bit about it in the previous Hot Topics discussion, but allow me to just go into a little bit of detail because it is germane to this conversation. We did a study online of about 1,000 individuals, and we listed about 20 specific platforms. Some were online pharmacies, some were e-retailers, even instant messaging services, and tried to ask a few questions about, are you using these to buy prescription products? And if you are using these, how often and how safe do you consider them? And even the least trustworthy ones that were explored, like Kik and TikTok, they still were on the spectrum of generally considered safe, which is really concerning. Even though online pharmacies and Amazon were seen as the safest, we have other platforms and instant message services like Wicker. Wicker was used to purchase sedatives, stimulants, and narcotics, followed by Tumblr and Pinterest. I mean, we're talking about buying opioids on Pinterest, right? I mean, if that's the conversation, we're in a lot of trouble, because if you think regulating traditional websites are difficult, you know, try to then move into social media. And you have these users typically are younger. Nearly 55% of them that said they did this purchased narcotics online on one of these platforms. 52% had bought stimulants, and about 30% had bought sedatives. We then asked, because it was contemporary, well, what about COVID-19 treatments and vaccines? And yeah, of course, 36%, give or take, had bought a COVID-19 treatment or vaccine
Mm.
via one of these social media platforms. So clearly a lot of work to do. I've had the occasion to meet with some families who have really tried to advocate on Snapchat around making sure
Mm.
Snapchat is actually regulating and policing their platform, because unfortunately their sons or daughters have died because of buying products on Snapchat. And again, it's a what it is, it's a connection mechanism for drug dealers, right? They're
Mm-hmm.
using Snapchat to advertise their product, and that's not okay.
Yeah.
There's no education being done. There's no regulation being done, and they'll say they're doing enough, but if people are still dying, are they really doing enough? And so there's a big advocacy effort around, well, wait a second, we need to be focused on not only the education of our younger population, but everybody, healthcare professionals included, around this migration from traditional web-based platforms to social media as a conveyance mechanism for prescription drugs.
Mm-hmm. And not surprisingly, when you think about counterfeit networks, they go to where their potential victims are. And so social media, yes, and tragically, as you indicated, it tends to be the younger generation that they feel comfortable on those platforms.
They do. And sorry to cut in there, Leah, but just to punctuate this, criminals are really smart. And I know that many of the individuals on this call and listening in know this, and it's not just healthcare products, it's really everything that's commercially available, that criminals are really smart at counterfeiting and selling and marketing. Well, medicines are no different. And so I'm on a college campus now. We're going to be coming up on final exam time. These criminals are going to hit social media with marketing advertisements around medicines to help you focus, like ADHD medicines and other medicines. They know when to ramp up sales based on demand, just like any other business. And that's a real scary thought when you're targeting a population that probably isn't armed with the right uh, with the right education to make really good decisions, and is vulnerable in a way that they're tired and exhausted, and they're looking at every single avenue to try to ace their exams. Again, at best, they're actually getting real ADHD medicine. At worst, that thing's laced with fentanyl. They're go to sleep in their dorm room and never wake up.
Yeah, thinking about that, and the counterfeiters paying attention to, okay, it's finals time. Let's go ahead and push out those posts on, as you were saying, some of those medications, some stimulus to keep them going. Again, not surprising, but just terrifying to think about. And again, with these platforms, the adolescents live on these platforms. That's where all their engagement is. So that's where the counterfeiters go.
Yeah, and particularly at a time when many of those kids, and I'll call them kids, but young adults and younger set of the population, were cut off from a lot of their social network. I mean, in-person social network, because of the pandemic, when we weren't having school in person and we weren't able to socialize or gather as much as we would have wanted to. A lot of them turn to social media and turn to these web or these social media platforms as a way to stay connected. And we've seen an increase in overdose and in harm because of that, is that they're in front of their screens 24/7, especially during the pandemic.
Mm-hmm, mm-hmm. And looking at another area, we've received a question from Ketty on what is being done about medicines that are being sold on the deep or the dark web in those markets.
Yeah. There is a whole other side to this, as you so astutely pointed out. I'm talking about the our web, the front facing web, the web that we can access every single day with Google and Bing. There is a whole different environment on the dark web where they're selling anything. And I don't get into all this detail because this is outside of my scope. I don't do much work in the dark web, to be perfectly frank. I let the experts do that work, because really my focus, Leah, is trying to prevent people who typically don't know what they're doing or are trying to do the right thing but get trapped. If you're accessing one of the search engines to go onto the dark web, chances are you're not doing it for positive or good or health reasons. You're doing it because what you know is wrong. And that's a side of healthcare that I just really don't touch.
Understand. So thinking again about social media and what we've learned from the threats that exist there, are there primary takeaways for certain sectors of society? So for medical professionals, for brands, I think you've kind of talked about consumers, but what should medical professionals and brands be thinking about when they realize that these postings are being made on social media?
Yeah. Well, I'm smiling because I think if you had asked me 10, 15 years ago when we were starting this work, I just said, just don't go online. Just don't use the internet, right? Because that was the easy answer at the time. Like, why would you even need to use the internet to buy prescription medicines? It seems kind of silly in retrospect because obviously the internet can be our friend and the internet's not going away. I think it's probably here to stay, right? So now it's how do you work with the internet and how do you do that safely? Clearly, education is a backbone principle here, and we must do more education of our health professionals specifically because we are an undereducated group when it comes to how our patients are interacting with healthcare online. We just don't know enough, and so there has to be more. We've done some work, at least in the pharmacy space, in integrating these concepts in our core pharmacy curriculum. I can tell you we're looking to publish a peer-reviewed article where we went to the 3 pharmacy schools within the state of Indiana, and we did some education on these topics and track some simple metrics like, hey, how comfortable do you feel counseling your patients about this issue? Pharmacists are the medication use experts. I'll kind of call us out here. We should do a really good job with this issue. Before we gave our educational material, 8% of the class felt like they were confident and comfortable educating and counseling their patients. 8%. After we finished, it was 100%. And we've seen that replicated at 3 different cohorts. So clearly, if we can start integrating early on into education, in addition to doing some just-in-time training with our health professional community, I think that will make a significant difference. There's also a lot of great work being done in the public education space. One of the groups that I'm really honored to be the board president for is the Alliance for Safe Online Pharmacies Global, or A-CAPP. And they're leading a lot of these efforts, partnering with other patient safety advocacy groups to do some public and PR campaigns around this to say, look, talk to your pharmacist, talk to your doctor, don't make choices alone. Here are some great sources to go to. There are websites where you can check your domain to make sure that it's actually legitimate. You just type your domain in there and it says, yes, you can go here, or no, this is not recommended. This is rogue, avoid at all costs. So again, education has to be the backbone. And then we got to do a better job partnering with our tech partners, our social media platform partners. They're trying, they're moving in the direction, but I think they continue to need a little bit of a nudge when it comes to being open to more collaboration and regulation of their platforms. We don't tolerate illegal gun sales on Google. We don't tolerate human trafficking on Google. Why are we tolerating illegal or substandard falsified medicine product sales on Google?
Mm-hmm. Mm-hmm. And what you were just saying about your pharmacy students, and I'm so glad that you've undertaken that type of education, because as I think of myself as a consumer, I completely trust my pharmacist. I mean, that's who I look for to tell me whether there's interactions with the medications that I may be taking. That is the trusted healthcare provider in addition to my primary physician. So getting them confident in talking about these issues is going to make a big impact for the consumers. In thinking, John, about the specific pharmacy brands, what from the studies that you and Salim did on social media postings, have you had any counseling that you've done with those pharmacy brands to talk about what they should be looking for or doing, or tactics or education?
Well, fortunately, I am in a position where I get to work with a lot of individuals from a variety of pharmaceutical manufacturers and brands, and they're all really invested in this from a patient safety standpoint. It's a true joy to work with many of them who are investing not only in staff and workforce, but also in technology and time on trying to track these down and prevent them from harming consumers. So, I just want to applaud the continued investment of those. I also want to call out something that's important too here. And since pharmaceutical manufacturers and brands are global, there's some great global collaboration on this that pharmaceutical brands and manufacturers are involved in, and they're investing in either through, again, workforce or time or other resources. I mentioned the Alliance for Safe Online Pharmacies Global, where we have representatives from a variety of pharmaceutical manufacturers, and they're supporting efforts like the one underway with the Asia Pacific Economic Cooperation, or APEC, where APEC countries are coming together to try to figure out what are global solutions to this, where we can actually work together, because the supply chain is global, the internet is global. It's not like we can take US-centric solutions and only limit it to the United States. Anything we do is going to be in collaboration with our global partners. The A-CAPP group, we have a contingent in the EU, where they're working in the UK and the EU on solutions, and it should be this bi-directional learning. What's working well in the EU or the UK? How can we bring that back to the US or Canada, or maybe our APEC work? So I just want to point out that even though a lot of our research is US focused, a lot of what I've talked about here is affecting the US consumer, this is a global issue, and it's going to take global collaboration in order to make significant impact.
And I think you've answered this question, but a question came up as to whether we should engage with the shipping companies in fighting this issue.
We should, and they are. So I do, again, it's not just our pharmaceutical manufacturers or brands. The shippers are also very involved in heavily invested in making sure they aren't the reason that those products are entering the United States. And it's our shipper brands, even our U.S. Postal Service. I've seen some great work coming out of our major mail sorting facilities in various points in the United States, who are investing heavily in technology and resource to try to capture these parcels coming into the country. As you can imagine, it's an incredibly difficult task, because it's not like you have typically huge shipping containers full of these counterfeit products. They're usually one or two bottles of illegal narcotic or pill or whatever that are entering in very small packages. And so from an enforcement and from a detection standpoint, that's an incredible challenge. And again, applaud a lot of those that are heavily involved in investing in doing that effectively.
Okay, and another question that came in, you talked about the prevalence of online pharmacies and the percentages of illicit versus legitimate. One of our audience members is asking, are there websites where the average person can go and check if the online pharmacy is legitimate?
Yes, there are. And there are two that I'll recommend. These are the two that I typically talk about. There may be others out there, so don't take these two as me only endorsing these two, but we have great partnership with these two. One is from NABP, the National Association of Boards of Pharmacy, where you can type in the web address and domain, and it will let you know whether it's recommended or not recommended. The other is a company called LegitScript that's been doing a wonderful job for a long time, and you go to legitscript.com, and you can type in your web domain into LegitScript, and it'll also let you know whether it's a verified pharmacy or not. I'll also call out another program that's being offered by the NABP, or National Association of Boards of Pharmacy, and it's called their .pharmacy program, which I think is pretty unique. I didn't know a whole lot about top-level domains before I got into that space. They didn't teach me that in my Doctor of Pharmacy program. But top-level domains like the .com, .edu, .gov, well, there's a .pharmacy available, and it's only controlled by NABP. It cannot be counterfeit, unlike holograms or other badges that right-click cut, right-click paste. .pharmacy can't be counterfeit. And so if you go to a pharmacy that has .pharmacy, John's Pharmacy, .pharmacy, you know that pharmacy has gone through the verification process that is supplied by NABP. And so you can feel really confident as a consumer to shop from that particular pharmacy. So there's this mantra, look to the right of the dot. If it says .pharmacy, you're safe. Unfortunately, there hasn't been as widely an uptake in .pharmacy as we'd like to see, but that's another program that if we saw some expansion can have significant positive impact on consumer purchasing.
Yeah, I think if the consumer was aware that that is the legitimate place to look, that will really grow. So thank you for that information. We're getting close to the end. So before we let our time run out, I did want to talk to you about the pandemic a little bit more and what has that done to change the landscape of online pharmacies? And is that a change forever?
Well, I do think it's a change forever. And as I alluded to in the beginning of our discussion, we've seen a significant rise in the use of online pharmacies in direct result of the pandemic. What's I think more concerning as it's not necessarily the rise in use, it's the rise in use coupled with the misinformation and uneducation. That's the problem. Because if you look at this rapid expansion of use, and then you look at some of these other data points that the Alliance for Safe Online Pharmacies gathered as part of their research, um, it's going to be a little concerning as I read them off. And one of them is 7 in 10 Americans, so 70%, erroneously believe that if an online website appears high up in a Google or otherwise search engine search, Bing, DuckDuckGo, it's likely to be legitimate, meaning that if we see a website on our first page of Google, which is pretty much the one that most people look at, right? One or two. 70% think that if it's high up on that list, that it's good to go, which is absolutely not true. In fact, many of first page search results are actually illegal online pharmacies. 40%, so 4 in 10 Americans believe incorrectly that all websites offering healthcare services or prescriptions online have FDA or other regulator sign off, meaning that if it's on Google and it's right there in front of me, well, the FDA must have looked at it. 40% think that that's the case when that's absolutely not the case at all, and has never been the case. So that also is concerning as we see an uptick. And then about 72% of those who we surveyed said that, yes, I started using in the pandemic and I'm going to continue moving forward, regardless of whether the pandemic continues. And so what we've done essentially is introduce a whole new cadre, a whole new group of the population to the internet, and they're going to stick with it because of that cost, convenience, and access benefit.
Mm-hmm. Mm-hmm. Okay. I think we have time for one more question. And you probably are familiar with this acronym, but have DSCA
Yep.
compliance mandates positively impacted anti-counterfeiting yet?
Yeah, yeah, Drug Supply Chain Security Act, and it has helped. I mean, and there are various provisions that are actually phased in. Most recently, I think last year was one of the last provisions or one of the final provisions of DSCSA. But yeah, it has helped bolster our traditional supply chain. Track and trace, there's a really exciting technology on the horizon, including the use of blockchain and other really great approaches to supply chain security that are going to continue to enhance the integrity of our supply chain here in the United States and many other countries that have adopted some similar approaches. Falsified medicines directive, in the EU, maybe held up as another great model. But the problem with the internet is a lot of the internet isn't part of the SCSA and isn't even in the traditional supply chain. And I think that's why we call out the internet as such a major growing patient safety problem. Is that yes, if you use the traditional supply chain, it is incredibly safe. There's the occasional issue, but it's very safe. If you use the internet, there's 95% of your opportunity to get it wrong. And that's what concerns us as researchers and advocates and leaders in this space is we just have such a hill to climb and we have a long way to go. Fortunately, there are a lot of people who are heavily invested in this issue. One of them being A-CAPP and MSU as we've been able to partner on this important work. We've talked about ASOP, we've talked about LegitScript and NABP, but there are countless others across the world who are engaged in these issues, including the WHO, the International Pharmaceutical Federation, the Fight the Fakes Initiative, and many others. So, fortunately, we're all in it, to do the right thing. It's just going to take that worldwide collaboration to do it well and actually have meaningful impact on patient safety.
Absolutely. Absolutely. Well, unfortunately, that is close to all the time that we have. But before we leave to the audience, please check out and register the next Hot Topic session in May, which will be on the latest trends on detection of illegal online sales of controlled substances, which is a nice follow-up to our discussion today. That session will feature Dr. Tim Mackey of the University of California, San Diego, Global Health Program, with Carrie Camel, our Assistant Director of A-CAPP Hosting. So again,
and let me put in a plug for Tim, because Tim's a brilliant guy and he's doing some groundbreaking work. So, if you're intrigued in these issues, I would definitely tune in to Tim's conversation.
Thank you. Thank you, John. And again, thank you for our viewing and listening audience. Have a wonderful day.